We're going to go to the phone. Eric Plinske from the Guam Regional Medical City, the Director of Corporate Affairs, joins us on the line. Hi, Eric. Good morning.
Good morning, Patty. Thanks for having me call into the show.
Oh, absolutely. It's my pleasure. Thank you for agreeing to talk to us. We wanted to get this story. We wanted to get this one out because I know that there are TakeCare patients in the time frame that you're talking about that have the potential to be hit with some pretty big bills. Can you explain what first of all, the relationship that you have or the lack thereof with TakeCare, and just what kind of conversations you're having to resolve this?
Well, thanks, Patty. Thanks for bringing light to the challenge we're facing with TakeCare. We've been working, trying to work with TakeCare since the day we opened, and the first challenge that we faced was TakeCare, in a letter to their members in September 2015, stated that they couldn't deal with us, GRMC, since we weren't at the time we opened either certified by the Centers for Medicare and Medicaid Services or accredited by the Joint Commission. That was September 2015. January 2016, January 8th to be specific, we became duly Joint Commission accredited and CMS certified. So that's over a year ago. So we thought that was, we made it past that barrier. Well, it didn't lead to much. We had no indication that there was any interest in signing on with us. It sounds like they felt we were too expensive then. We didn't feel that held a whole lot of weight since the other three health plans, all the other plans, had agreed to negotiated rates with us. Two of those plans, Netcare and Stable, are smaller health plans than TakeCare. So, the statement that we're just outrageous in price, didn't seem reasonable because the other folks, the other health plans had agreed to the rate, the rates that we had offered, the discount rates we had offered, and we offered those same discount rates to TakeCare.
Is it all the same? It's not all the same rate.
It's pretty much basically all the same. Similar rate structures, and we originally, TakeCare was not happy with us because we had a kind of a timeline to take advantage of the substantial discounts we were offering when we first opened. Maybe you want to call it the early bird rate. Join us early, you're going to be able to benefit. And then we said there was a timeline to take advantage of those rates, and if you didn't sign on with us by then, then the rates may not be as the discounts may not be as substantial. So they felt that was not reasonable. Regardless,
Eric, I
think someone's hitting a
yeah.
island. But anyway, we extended those rates to TakeCare even beyond that deadline. So we were trying to be reasonable. We got two issues, Patty. One is since July 2015 when we opened all the way to present day, there's historical claims for TakeCare members, whether they work for GovGuam, whether they work in the federal market, commercial groups, you name it. Those bills have been accumulating to over $5 million. We've been paid little to nothing for those bills. Now, we have not sent those bills to the patients because we have a hope that we could work with TakeCare and resolve these, settle them at a reasonable settlement. And then the separate issue is the moving forward. We're trying to get a contract so we can be an in-network provider for all TakeCare members. The challenge is that patients come to hospitals through an emergency room. They don't worry, or an ambulance doesn't start asking a patient, "Oh, I'm sorry, excuse me, ma'am, sir, do you have, are you covered at this hospital, or do you have TakeCare?" Or that's not discussed. And when they come in our emergency room, we don't ask them anything about who they're. Do you have any money? Do you have a health insurance? Who do you have? We don't ask that. We just treat them. Many emergency room visits result in an admission because there's such a serious situation. Those are when the big bills hit, the emergency room and the admission. Now, if you're suddenly a health plan is saying, well, you're a non-par provider, and you're pretty much basically responsible, you the patient, you the member, for paying bills yourself, and then seeking reimbursement later. Eligible charges. Not sure what's happening there.
I don't know. Are you at work or something?
I'm not touching my key there. I don't know where that's coming from. Sorry, folks.
I don't know if that's make sure it's not your cheek touching the.
Yeah, I know. I got totally separated there.
All right, but that's okay. So
but anyway,
we got you now.
They're getting stuck with these bills that we haven't sent them to the patients because we know it's not fair. They're paying their premiums. They got a health plan. why not get the coverage you need, especially when these bills are coming as a result, likely, of an emergency situation resulting in an admission. And, you know, that really is unfortunate. But if we don't have some type of settlement soon, we're going to have no choice but to delay these bills to the patients. And by the way, when a health plan doesn't negotiate a contract with a provider, there's no discounts provided. So those bills are at list price. No negotiated rates health plans get. So.
And then they're going to have to go after TakeCare individually. Do you have an average bill, an average estimate of the bill?
Well, you know, I could give you some ballpark. You know, everything changes by the complexity of the condition. But, you know, if some of these average, you know, if you're an inpatient for a while, $30,000. You know, I could give you an average, that's without any discount negotiated for the health plan, you know. So if you suddenly got a bill for $30,000, I don't think a lot of people have $30,000 sitting around.
Not to pay a bill immediately. Not within 30 days. Great. But, but TakeCare's own non-participating provider benefit clause states, you, patient, pay the bill. Then you can come to us and seek reimbursement at eligible charges. Well, there's the trick phrase. Eligible charges are not billed charges. Mm-hmm. They're TakeCare specified charges that they determine, and usually they are the lowest of the low. They'll look at what's the Medicare rate for that particular service, or what's the lowest network provider contracted rate for that service, or any other possible reference, and then they'll take the lowest one, and then they'll reimburse you 70% of that. Yeah. And I used in the public hearing for Bill 3-34 with Speaker B.J. Cruz, we gave an example of a room rate. We're a private room hospital here at GRMC, so all our rooms are private. At GMH, primarily they have semi-private. They may have a partition or a curtain between patients. So the room rate for a private room here is $2,400 at list price and about $600 at GMH. So if you found the money to pay just for the room, that's not all the services, surgeries included, $2,400 to GMC, went back to TakeCare to seek reimbursement, likely they're going to look to the rate of, well, it's the lowest. Okay, GMH $600. What's 70% of $600? About, $420. Here's your $420. Well, you eat the $2,000 difference. That ends up being only 17% of billed charges. Now, if someone has a health plan, they're paying premiums, they had an emergency, they're admitted, how is that fair? And so we're seeking a reasonable negotiation. We'd like to settle with TakeCare on these old claims. We're not asking them to pay all the $5. We realize that we've got to be reasonable. All the other health plans have worked with us. Okay, Eric, I've only got like a few minutes left. I wanted to work in a phone call from Joe. He had a question for you.
Okay, great.
Joe, go ahead.
Good morning.
Hi, Joe.
I'm under TakeCare. I also have Medicare. If I go to GRMC, can I use Medicare to pay for my bill there?
So that's a great question. A lot of times, what's called primary insurance and secondary insurance, it's not a patient's choice to determine which one they want to be first, but likely for you, you're lucky that likely your Medicare is probably your primary insurance, and then TakeCare would be the gap.
Yeah, no, it's not.
It's not?
I think it's, but the fact that I can't use it there at GRMC, does that disqualify my primary insurance?
Your primary insurance is what?
Is TakeCare.
Is TakeCare.
And I notice in the Medicare, rules that you use the primary insurance first.
If I could ask this, sir, I know it's a personal question, but are you over the age of 65 or older?
Yes, I am.
Then I believe, unless you're working for a large company, which would
I work for the government.
Government of Guam?
Government of Guam.
So they might be, there's so many nuances to determining primary because the government of Guam may be considered a large employer, therefore maybe Medicare would be secondary, TakeCare could be primary. And I'm not a specialist on determining which one's primary or secondary, but you may be at risk, and likely, I don't know if Medicare would cover the full difference between what TakeCare may determine as not being eligible, or generally TakeCare wants to only reimburse you after you paid your bill. So if Medicare would pay, then you would have a remaining balance. You'd submit it to TakeCare. They would say, well, you pay it first likely, and and then we'll reimburse you 70% of eligible charges. It's a good question for TakeCare, though. I wish they would call in and explain
we'll see if
themselves
we
on
can
these
work that
very
out.
unique terms.
Yeah, I've only got a few minutes left. Joe, thanks for the call. Eric,
thank you very much.
Okay,
Thank you.
absolutely. Eric, just real quickly, what is your timeline? Now, what's your final push point?
Well, Patti, this all came up because Speaker B.J. Cruz introduced a bill for the GovGuam health insurance trying to look at lowest possible option. We tried to explain, look, TakeCare has been evidently submitting the lowest exclusive bid, but they don't have us in network, so their cost structure is lower. They are, obviously having a competitive advantage in pricing premiums lower than the other plans who've all put us in network. So we're asking in the bid, require that all health plans bidding must have GRMC in their network, as well as all other local hospitals, GMH and Naval for that matter, to make it a level playing field. If you think if they think they're saving money for the government, all that extra savings is really just going on to the patient. That is not fair.
So you want to be included if they're pushing for all health insurance
We're not
providers.
Anyone to come to our hospital. We're just saying we need to have us as an option, so that especially when they come to the emergency room and get admitted, they're not stuck with these bills.
Okay.
And it's different from clinics where it's elective. You're not in a situation where ambulances drive you to the nearest hospital to save your life. We're a lot of times we're in Dedido. We're in the largest villages, Jigo and Dedido, where most people live, and so they're likely going to end up in our hospital.
Well, you have a number of occasions when that has happened, just your proximity, for sure. That's a point. But, Eric, quickly, what again is your push point? What is your timeline for where you will start billing the patient?
Well, we don't have any drop dead date or cutoff date, shall I say? But we want to push this because we are not going to continue this GovGuam and federal market open enrollment period and bidding without letting the public know what's going on here. And what all TakeCare members, if you've come to our hospital since we opened, you likely got a bill here, and it could be quite substantial.
All right.
Well, sent it to you yet.
Okay. Well, heads up. TakeCare patients. Eric, thank you for the time. Appreciate it. Thanks
a lot.
Have a wonderful day.
Thank you very much.